Hi moms and dads, a very warm welcome to another episode of Today's Parent, where we connect you with experts and provide you with information to make your parenting journey a bit more easier. I'm your host Christine Casina. In today's episode, we are going to talk about ENT problems, ear, nose and throat infections. The one thing that takes us parents to the hospital is when our kids have ear, nose and throat infections, which is a common thing. We have Dr. Wahome, who's going to enlighten us on matters ENT. Dr. Wahome, welcome to Today's Parent.
Thank you so much, Christine. It's a pleasure to be here.
It's wonderful to have you. It's wonderful to have you. Tell me one thing. How is ENT connected? Because it's always ENT, ear, nose, and throat. How is the system connected?
Okay, so ENT, which means ear, nose, and throat, and has also an addition of head and neck, are interconnected through the back of the aerodigestive tract.
Right.
So your hearing or apparatus, which is the ear, is also connected to the back of the nose through what is called your eustachian tube.
Okay.
And that eustachian tube opens up into what is called the postnasal space, which is within the nasal cavity, and which continues through the oral cavity or the mouth up into the upper aerodigestive tract, which is the head and neck area. Meaning, if you had a disease in the ear, then it could possibly give you symptoms and signs also at the back of the nose, which would also be found within the throat and vice versa. So I guess the founders of this profession thought it wise to be able to deal with it holistically. Right. So that's the connection.
Okay, I should mention, actually, it's very important for me to mention that you are an ENT specialist and
Correct.
a surgeon. Correct. How did you end up choosing this field?
So in the initial part of training, many doctors in training are unaware of what the future in terms of specialization for them would be.
Right.
For mine, it was a combination of factors, one of them being accidental, through nice mentorship during training that inspired me to be able to become an ENT. It looks very small when you look at it from the surface, and people wonder, wow, you're just an ENT surgeon, that's all you do. And but when you dig deeper into the field of practice, there are actually subspecialties in ENT.
Under ENT.
Yeah, so you have pediatric ENTs, you have rhinology and skull-base surgery, which is purely the nose, you have head and neck surgery, and you also have otology or ear surgery.
And I think you're much needed because a lot of us parents end up, in hospital with ENT issues.
Correct.
And the point of today is understanding the common ENT problems. So let's start with ears. When it comes to ear issues, what are the kind of issues we have?
So generally speaking, you could easily divide diseases into either congenital or acquired.
Right.
Congenital means you were born with, acquired you get later on in life.
Okay.
And so when you talk about the ears, there may be some congenital abnormalities. You may have seen children who are born with a lack of an ear or a small ear or some other defects around the ear, which are called skin tags and so on. One of the common things that you find is a space at the front of the ear, just in front of the ear, which is a small hole. That's called a preauricular sinus. Many of us are born with it, and it has a huge genetic inheritance. Okay.
And it's a hole you can see?
Yes, it's a hole you can see at the front of the ear. So if you have it, your child is likely to have it, and your grandparent would have had it. Generally are not a problem, but for some people, this can get infected. So you have a congenital problem called a preauricular sinus that can get what is called a preauricular abscess. So in terms of the ears, if you divide the problems, and there's the congenital ones like microtia, which means you have a small outer ear, which is visible and is an aesthetic
problem. Small outer ear.
Yes, a small outer ear.
Maybe, Doctor, where we need to start from is why are ears important? Because, we've never thought about the sizes of ears. But what comes to mind is the size of former President Obama's ears.
Yeah.
So what's the importance of ears?
Okay, so and that's a good place to start. Thank you for that, Christian. So ears are a very complex organ which houses two distinct senses. One is hearing, the other one is balance. And these are housed within what is called the inner ear, where you have the cochlea that's responsible for hearing, and you have the semicircular canals and the organ of balance. Now, that is the function. Right. So our ears help us to perceive our environment in terms of the relationship with space and time. So we're able to walk without feeling imbalance. You're able to swim. You're able to move from a soft to a hard surface as you walk. And balance is a function of predominantly a functional semicircular canal or balance system. And hearing is as a function of a proper ear canal which goes on to the eardrum, which is called the external ear canal, and what is called the middle ear. So if you have any problem along that pathway of development of the ear, you could have either balance disorders or hearing disorders.
Interesting.
Yeah.
All right, then going back to the common ear problems that we have.
Correct.
Which ones do we have?
So one of the commonest ones, of course, based on the function, is hearing loss.
Hearing loss.
Yes, and hearing loss would be congenital. If you have a family where you have a history of people who do not hear, deaf and dumb, then you should suspect or you should be careful in how your children are responding to the external environment, because they may have been born with a hearing loss.
Okay.
And hearing loss can be divided into different categories. You can have mild, moderate, or severe, or profound. Profound is somebody who is completely deaf to the external environment, and there are children who are born that way. But funny enough, hearing loss is more commonly caused by infection. So the commonest cause for hearing loss in children is actually middle ear infections. So whereas you can have a hearing loss as a problem, and it's common, ear infections are even more common, and those ear infections can lead to a hearing loss. So those are some of the major problems with hearing.
Right.
Hearing loss and hearing infection, or sorry, ear infection.
Right. I'm just wondering how you can tell when a baby is so small that a child has an ear infection.
So first of all, yeah, that's one challenge of children, is they cannot be able to meaningfully communicate, depending on their age, or they may not be able to verbalize the symptoms that they are feeling.
Right.
Sometimes even when they're able to speak. Fortunately, infection signifies what is called inflammation or irritation in a particular part of the body. So when a child has a middle ear or an outer ear infection, then because of inflammation, one of the primary symptoms they get is actually ear pain. So they will scream in pain. So one of the commonest causes that takes parents to the ER or to the clinic, or to our clinic, for example, is actually, my child was crying at night. They were trying to hold on to their ears, and they had high fevers, because infection comes with high temperatures, and sometimes maybe even convulsive problems. So their temperature is high to the extent where a child will undergo convulsions. And also nausea and maybe a bit of vomiting. So your child may not tell you that they have an ear infection, but by their signs and symptoms and touching on their ears, you will know you're dealing with an acute or an present ear infection that you need to deal with because of the symptoms they'll exhibit.
Right. And what about a child? You know, you have children who are constantly putting their hands over their ears.
Correct.
Is that something that a parent needs to worry about?
Yes and no. It could be habitual, but certainly it's something that would need to be investigated. If your child is constantly doing that, it could mean a couple of things. They have an external ear irritation, which might be what you call eczema, or an inflammation of the ear canal skin. Correct.
Okay.
Yeah. So if your child has allergies that are coexisting with that behavior of scratching or holding the ear, it may mean that they have a bit of eczema of the ear canal. And the treatment is usually avoiding the things that would cause allergic reactions, things like contact, the soap they use, and probably also some medications, which would include eardrops. The other thing would be that they are hearing too loudly, or they are disturbed, so they may even have a developmental abnormality, or they are getting something called tinnitus, or they are getting some level of imbalance, or they have a middle ear infection, in which case then you need to do something about it. The other common disease with children that also causes hearing loss is what is called suppurative otitis. What that means is that, serous otitis. What that means is you actually have fluid filling up the middle ear cavity of a child. And it's common, especially in the early childhood learning category of children, because they have shared environments, it's upper respiratory infections, which also are translated towards the ear, and that will lead to fluid buildup, what is called glue ear in the ear, and that will reduce the hearing of a child.
Right.
Yeah.
You mentioned about balance disorders when it comes to ear infections.
Correct.
And are there different types of, you mentioned there are different types of balance disorders, if you could just mention a few?
Yeah, so there's different types of balance, and balance is a function of basically the balance center within the brain and also the semicircular canal in the ear. Commonly in children, if you have serous otitis, or you have fluid in the middle ear, it can cause some irritation within the balance organ. And so children may have an abnormality of speech, or they are having to say, tune up the volume on the TV to be able to appreciate. And when you call them, even when they're not really focused on one particular activity, they do not seem to be hearing you well.
Okay.
Now, if that coexists with a bit of imbalance, then you know spot on that it is being caused by that serous fluid or fluid within the middle ear that may need to be treated.
All right.
Yeah.
Let's go to nasal infections.
Correct.
Infections related to the nose.
Okay.
Running nose, is this something that a parent needs to worry about? Of course, when it happens to an extent that is, I don't know, too often, too much blood, where or at what point does a parent need to worry about, you know, not even a running nose. Let's start with nose bleeding.
Okay. So first and foremost, the nose is a very, again, a complex organ, which meets with at the back of the nose and communicates even with the ear and the rest of the throat. And it serves a couple of functions. We are able to smell or appreciate the food that we eat or certain smells. We know the gas is on in the house, therefore we need to look for it. So it's also a very protective instinct. The nose also modifies the air that we breathe, so that you have hairs at the beginning of the nose that trap huge particles. If an insect tries to get in, it will be prevented by these. And then also larger particles would be trapped by the mucus that's produced within the nose and swallowed up and destroyed by enzymes which are within the nasal cavity. So the nose really is the beginning of the lower airway that protects the airway. So you need a functional nose for both the capacity to be able to breathe, to be able to smell, and to be able to enjoy life generally.
Right.
So, and because of this function, there's a huge blood supply to the nasal cavity. And that blood supply can get disrupted and you can have nosebleeds. Now, in children, the commonest cause of nosebleeding, believe it or not, is actually nose picking. Yeah. So nose picking. Nose picking. Putting in the finger in the nose.
In my house, they call it fishing.
Yeah, fishing. Yeah, that's the thing. So that's the commonest cause of nosebleeding in children, especially between the ages of 2 and about 7 or so.
Oh, wow.
Preschoolers and junior school children, before they kick out the habit. And so it's good to understand what are the things that are causing my child to pick their nose a lot. Is it that they're having a lot of...
That nose picking can actually cause you to nosebleed?
Yes, because you will traumatize. And the majority of blood vessels that enter the nose into what is called the nasal septum, which divides or septates the right and the left nostril, is a huge blood supply region. And when you put in your nose in that region, you're actually traumatizing that area.
Right.
And you can lead to an opening of those blood vessels, which usually don't have valves. They're tiny, but they can result in a lot of nose bleeding.
Okay.
There are other causes of epistaxis or nose bleeding, including infection, medications that you're using. If you have an upper respiratory infection because of the inflammation or irritation within the nasal cavity, then you're also bound to get to nosebleed, especially if you blow your nose aggressively.
Right.
The other more serious, like blood coagulation disorders that a child may have, that can lead to nose bleeding and can be a pointer towards further investigation.
Right.
All of which would probably be done once you evaluate a child.
All right, let's take a short break and then we'll be back and continue the conversation.
Thank you.
In our conversation today, we have Dr. Wahome. He's an ENT specialist, and we are talking about ENT, the common problems when it comes to ear, nose, and throat infections. We are going to take a short break, and we'll be back right after this.
Thank you.
We are back from the break, and in today's conversation, we have Dr. Wahome, and we are focusing on ENT problems. Dr. welcome back.
Thank you.
We are back from the break.
Asante.
We have a question that has come in from Rose. Rose is asking, when should tonsils be removed? I know when it comes to matters ENT, tonsils is something that we are going to talk about as well, but now that the question has come in,
Okay.
tonsils, when should a parent be worried and must they be removed?
Okay. Yeah, that's actually one of the most common answers, and believe it or not, also one of the greatest...
Common questions you mean.
Yes, and a bulk of our work in children revolves around tonsils and what are called adenoids. Maybe to effectively answer Rose's question, I'll just quickly tackle what tonsils are.
Right.
So tonsils are a group of immune tissue that is found at the back of the throat. You see it in cartoon characters when the mouth is wide open.
Yes,
You see that thing
yes.
hanging in the middle. That's the uvula. And on the right and the left, what you see bulging are the tonsils.
Okay.
You also have tonsil-like structures found at the back of the nose, which develop usually from the age of 1. Now, tonsils have a very important function, which is in immune development. But this function is important up to the age of about 2.5 to 3.
Right.
Meaning if a child older than that requires their tonsils removed, then it usually would be okay. Sometimes you'd find you'll maybe need to remove them even earlier, depending on the indication. So to answer the questions of tonsils removal, tonsillitis is a commonest reason why we do tonsil surgery, what is called tonsillectomy. But there is a guideline, especially because these are children who have started to go to school, and we have talked about their predisposition to upper respiratory infections, shared items, sweets and sugars, which I hope can be reduced, especially in school, and monitored. Sometimes you may not be able to monitor these children. And therefore, 1 or 2 bouts of tonsillitis in a year is probably agreeable for children.
1 or 2?
Yes. But if a child has 7 or more episodes in 1 year,
that's a lot, huh?
yeah, which is a lot. And by that I mean it has been looked at by a clinical person who has determined that this is a tonsillitis, and you can see maybe there's a bad breath, painful swallowing, and there's actually real inflammation which would require an antibiotic to treat. That is a definite bacterial tonsillitis. Now, if you have 7 in a year, you need them removed. If you have 7 in a year in 2 consecutive years, you need them removed. And if you have 3 per year in 3 consecutive years, you need them removed. The other thing is, if they're huge and they are causing obstruction, difficulty eating, in combination with enlarged adenoids which are found at the back of the nose, yes, you need to remove them.
Okay.
If they are severe enough to have pushed you to, for example, 2 hospital admissions, or when you get your child gets tonsillitis, they actually get convulsive disorders because of the high fevers, then the tonsils need to be removed. So those are generally the main indications for tonsillectomy.
No, that is good to know. So let's move back to throat problems.
Okay.
Swallowing problems. Is there something like that?
Yes, there is.
How does that occur? And you know, at what point does a parent need to get worried? Or how do you notice as a parent that your child has swallowing problems and this is an issue? Okay.
So a swallowing problem would be not so, unfortunately, not too dramatic, but depending on the severity. A swallowing problem means that when the child is having food, either, and most children in that age group of between, again, 2 to 6 are not good eaters. They'd rather do something else than eat, and therefore sometimes you may miss a swallowing problem. But effectively, if under monitoring you find that your child is choking or coughing during feeding, or struggling and holding their necks during swallowing, or having mouth breathing, or an abnormal holding of the head at the front, then you know there's a swallowing problem. Now, there are different causes for swallowing disorders. One of them is infection. You may be dealing with a tonsillitis, you may be dealing with pharyngitis, or inflammation of the back area of the pharynx, in which case your child will also be looking quite unwell.
Okay.
There may be other reasons to have swallowing. For example, a swallowing problem. For example, very large tonsils, and therefore the passage in the food canal might be a problem. The tongue might have a problem. There is a very common problem called tongue tie or ankyloglossia. Yes, and at the lower rim of the tongue, you find that the tongue is actually tethered to the floor of the mouth, and therefore there is no adequate movement of the tongue, which is essentially just a group of muscles. So you find in such a child, if they're already speaking, you will see that they're having a least speech, so a heavy tongue, or they're having swallowing difficulties. You can have swellings which are external that are also causing a narrowing of the passage for the food passage, like lymph nodes that are enlarged, salivary glands that are enlarged. You can also have a neurological or a nerve problem that leads to a swallowing abnormality. Many times this would be associated with also choking, a bit of cough during feeding because of what is called aspiration, and especially depending on the category of food or food material that somebody is taking.
All right. Yeah. You know, growing up, I remember seeing somebody who had a swollen neck.
Correct.
And I came to learn that it's called goiter.
Goiter.
Is it common? Is it something that is common, or?
Goiter is not too common in children, fortunately. Goiter is an enlargement of the thyroid gland, which is a shield-shaped organ at the front of the neck. It's more common in adults, more common in females than in children.
Interesting. Yeah. I wonder why. Why is that?
There's a hormonal relationship to thyroid disease.
Okay.
But fortunately, most goiters are well manageable, either through surgery or through medication.
All right.
Correct.
Daktari, let's talk about snoring. Is it related to ear, nose, throat, or it's a throat issue?
Absolutely, it's related to all. And the reason is the airway is, there's a nasal airway, there's an oral or pharyngeal airway, and the pharynx is basically the back of the throat, and also a laryngeal airway. So in any passage of air as you breathe, because there's the passage through the nose, the passage through the mouth, and eventually through what is called the larynx, which is the voice box. The voice box houses the vocal cords, and that's where sound is produced. And that's also the same passage or entrance for air as we breathe. Now, if you have any disease in any of these parts, then that can lead to snoring. Now, in children, one of the commonest causes of snoring is nasal airway obstruction. And the reason for this is because children are what you call obligate nasal breathers. They are obligated to breathe through their noses, and therefore they have not developed the capacity or the ability to breathe well through their mouths. Now, adenoids are found at the back of the nose, and in children beyond 1 year, they develop. And in some of these children, either because of allergies or other predispositions, the adenoids can grow very big. And when they do, they cause a post-nasal space narrowing.
Right.
That now, so you have a very nice, what is called laminar flow of air into the nose, but as it's approaching the back of the nose, it's going through a very narrowed passage, and therefore you have the typical loud snoring. And on top of that, you might have mouth breathing. If you have a big tongue, huge tonsils at the back of the throat, then you may also be snoring. And this is one of the common causes of snoring in adults. And also in the laryngeal space, if you have abnormal development of the laryngeal musculature and other structures around the area of the throat, again, if this causes narrowing, you can have snoring.
Okay.
So what's most important is, in this child who is snoring, is this a recent snoring or have they snored since birth? Do they have a normal cry or normal speech? Because that will tell us that you're talking about laryngeal airway obstruction. Do they have problems with feeding or swallowing? And on top of the snoring, do you have some of these cardinal signs, which means, is the child mouth breathing? Is the snoring very loud? For example, a common question is, if you listen to them from outside the room, can you hear them breathing? And sometimes they'll say, anangorota kama mtu mzima. Now, that is unusual. And then on top of that snoring, are they also stopping to breathe? Are they having sessions where they actually stop breathing, which is called apnea or lack of breathing, and then they go back to breathing or they wake up?
Okay, and how about when it comes to nasal problems?
So, for example, snoring. The child who is snoring is undetected and they actually have apnea, so sessions where they are not breathing. That means they're exerting themselves during their sleep more than usual. These are children with a heart that is not fully developed, that is overworking. If you touch their chests during the time when a child like that is sleeping, you will notice that the heart is beating faster than usual. Over time, this creates pressure on that heart and therefore would lead to a heart disease, or what is called cor pulmonale, which would, of course, give you a very poor prognosis in terms of quality of life.
Okay.
Nasal blockage also, and all that would also be associated with problems in school with learning, concentration,
of course,
and even neurological or brain development, and even physical development. They'll never achieve their full potential if they are left untreated.
Untreated. Yeah. You know, I'm just wondering, these are things we, as parents, sometimes we take for granted, and especially when you're a first-time parent, and you've told maybe your mother has called and you've said you've taken your child to hospital for tonsils. And then the grandma asks, unapeleka to hospital, tonsils too?
Tonsils too, yeah.
So your word of advice for parents who are watching, when do we need to become, cognizant to the fact that this is a point where I need to take my child to hospital? At what point do you need to get where I need to come and see Dr. Wahome or go and see a specialist?
Okay. So the good thing is, by the way, world over, tonsil or ear disease is actually the leading reason for parents taking children to hospital. So the good thing is, you do not need an ENT specialist to treat a tonsillitis. You, however, need a good clinical person to be able to identify a tonsillitis and to be able to give you the right medications at the right dosing for your child. Because sometimes your child is treated with the right medicines, but for a shorter duration of time. So as long as you are well and properly treated by a clinical person, then that is good. Now, the specialist referral to see an ENT specialist like ourselves would be in the background of the recurrence that is that is too frequent, and a child whose tonsillitis doesn't seem to go away
All right.
despite treatment.
All right.
But it is certainly very important if a mother has a child having pain, crying, and refusal to eat, and probably even a bad breath in the mouth, to consider tonsillitis and to have it properly treated.
All right. Talking about treatment, for any parent who's watching and they want to connect with you, Dr. Wahome, how do they get in touch with you?
We are found in Prodigy ENT and Hearing Clinic, located in Upper Hills KMA Center, and we are there open every day of the week and half day on Saturdays. So they're most welcome to visit us and we can interact. We do not operate though in the clinic, because sometimes parents would come and ask us, tunatoa hizi tonsil saizi. No, we do not do that.
Okay.
Why? Because tonsil surgery is actually a major procedure, and along with all these other surgical operations. So those we would do in other hospitals.
All right. Yeah. Thank you, Daktari, for coming to share.
Thank you.
And I hope we can host you in a future show so you can share with us how we can manage these ENT problems.
Looking forward to it. Thank you so much for having me, Christine.
And thank you so much for your time.
I appreciate it. Thank you.
In our conversation today, we had Dr. Wahome and we focused on ENT problems. I hope you have learned something when it comes to matters ear, nose, and throat infections. If you have any other questions for Dr. Wahome, please send us an SMS and we'll be sure to focus on it in another episode. I have been your host, Christine Casina. We've been here in studio at Little Cribs, the home of fun, exciting, durable, and affordable kids furniture. This has been today's parent, and we look forward to having you next time. Thank you for watching.